Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
How does marijuana affect teens' development?
First thing, immediately in school, it's going to reduce their ability to concentrate, their ability to learn, and therefore declining grades and poor school performance. In addition, when they use it on a regular basis, they're very emotionally labile, and that can show up as behavior outbursts in school that would otherwise be uncharacteristic for that teenager. And then long term, we'll see those decreases in IQ, cognitive functioning, executive functioning. So we're looking at an effect on their future where they may not get into the college of their choice, or may not get into college at all, or have trouble holding down a job and a career. Socially, their interactions start to become more part of that drug culture only. Their friends that they start to pick are friends that are fellow users, and often they, relationships that they had before that were meaningful are no longer there. And it eventually reduces their ability to socially interact appropriately with people.
How has marijuana affected your patients?
We see kids as young as 12 and 13 using marijuana. They're having trouble even getting to school in middle school. We've seen kids in high school just think this is totally acceptable. And in their minds, they're actually thinking their life is better by using it. But when we talk to them, they suffer from lack of motivation. They've had to quit their sports, their grades are falling, and when we see young adults, they have nothing going on for them. They can't even hold down a job. So it is affecting them, but in their minds, they feel like this is still an okay drug to use.
What are some of the physical symptoms of marijuana use?
It is something that is inhaled, and teens are smoking it. Therefore, they're at increased risk for respiratory illnesses, respiratory infections. They're at increased risk for GI side effects such as vomiting and inflammation in their esophagus, and increases in their heart rate that can last up to hours.
Marijuana has been referred to as a gateway or beginner drug. What does that mean?
It is definitely a beginner drug, partially because of the way it affects the brain chemistry, in that basically you are now taking over the brain's ability to feel pleasure. It is also a critical time for brain development. The brain is still making connections, and we're interfering with these connections. Adolescence and young adulthood is a critical time. So that brain gets geared to thinking it needs drugs in order to feel good and to function. And once you start using one drug, you tend to get into other drugs. You tend to get into that culture of drugs and engage in high-risk behaviors.
Why is marijuana use during the teen years so critical to a teen's development?
Because it's such a critical time period, there are well-documented studies now that show that long-term marijuana use will lead to a lowering of IQ. It will actually lead to problems with critical thinking, with memory, and with executive functioning. So therefore that affects them immediately in their performance in school, but also will affect long-term issues with further education and in their careers.
What is the correlation between mental health issues and marijuana use?
Marijuana produces a high, and teens will use this drug to feel better. They want to escape these feelings of anxiety and depression that they feel. And if you ask them, they will always tell you that they were trying to cope with a stressful situation. And it can be anything. I've seen kids who have been bullied that have used it, that are coping with stress at home, that have had trouble with peer interactions. It could be as simple as a breakup with a boyfriend or girlfriend, but they all rely on it to feel better. And what we know, that long-term marijuana use actually causes mental health issues such as anxiety and depression. Marijuana remains the most common drug used by youth right now. 16% of 8th graders have tried it. 45% of kids will have tried it by the time they graduate high school. 22% of those are habitual users, and 6% are daily users. And I do believe that the majority of these habitual users and daily users are self-medicating. The other issue that's come up with this that makes it very dangerous is they're perceiving it to be very safe. They're perceiving it to be a medicine, and therefore are using it very indiscriminately. Many teens believe that driving under the influence of marijuana is safe. In fact, 1 in 3 college students has driven with somebody who has been high on marijuana.
What trends have you seen with marijuana use as states try to legalize it?
The more society does this, the more normal this starts to feel for teenagers, and the more acceptable they think it is to use. And right now, Colorado leads the nation in teen marijuana use and use of other drugs. In Colorado, there's been a 40% increase in suspensions and expulsions from school since they legalized recreational marijuana. Fatalities from motor vehicle accidents have increased dramatically in both Colorado and Washington State. In Massachusetts, we've seen similar trends already. When it was decriminalized, we saw an acceptance and an increase in teens using marijuana. When it was legalized for medicinal purposes, we saw another surge where teens have started using it. And we now know in Massachusetts, medical marijuana is being diverted and sold to youth to use. So definitely there's a huge correlation between this trend to legalize and improper use by adolescents.
When it comes to drug use, what should parents look out for?
Changes in behavior are key. You know, your teenager could become suddenly more withdrawn, maybe even withdrawn from friends they used to have, or maybe have a new group of friends. Declining grades, mood changes, spending more time alone in his or her room, more time on social media and on the internet, may become depressed, have anger outbursts. And just some physical changes. For example, if a child is smoking marijuana, they may suddenly start coughing more and suddenly have respiratory symptoms they may never had, or gastrointestinal symptoms they never had.
As a doctor, what do you tell parents is the best way to help their child if they start using drugs?
The first thing is talk to your teen. Talk to your teen beforehand when they're younger, so that they know that you are somebody they can always confide in if they're feeling stressed or anxious or depressed, so they don't turn to drugs. However, if you do suspect, don't judge them and don't punish them. Let them know you're there to help them and encourage them. Tell them to be honest with you. I tell parents not to order drug tests to test your teenager. Have that open dialogue. That's much more important. Have them speak to their primary care provider and seek mental health treatment as needed. Parents set the best example for their kids. Kids will follow their parents' example, and if a parent can say, oh, I'll smoke it every now and then, that teenager hears that message, and that's the wrong message for that teenager to hear.
What are your thoughts on the upcoming ballot question?
My argument against this ballot question is very simple. Teenagers, by realizing that this is a legal substance, will think of it as an acceptable substance to use. And we now know, as I've said, this is not a safe drug for adolescents to use, both for physical side effects and for long-term behavior and cognitive effects. We've seen the data from states that have legalized it, and we don't want to repeat that in Massachusetts. We don't want that kind of, we've already seen this surge with the legalization of medical marijuana, and we don't want to see another surge.